Resident doctors strike bites a bit harder, more suffering and excruciating pain for helpless patients, relatives groaning and lamenting. Meanwhile, our president is in faraway England, receiving the best healthcare with our taxpayers' money, if I do say so myself. Where's the place of empathy and selflessness in governance? Everything just seems demoralizing, and we'd like to hear your thoughts on this. What would you say concerning the treatment of Nigeria's health sector to Nigerians in Nigeria?
So let it not seem like we're just, ranting again. Because there's no how you don't sound like having a rant when you talk about this. But the truth is, it's not President Buhari alone. Everybody that is member of the Grand Council, or what's it called, that council of ex-presidents and heads of states and speakers and Senate presidents are responsible for where we are today.
Yes.
So they all have their medical doctors abroad, all of them, plus members of cabinet. It's not news that the president, he didn't just become president and suddenly have his medical checks abroad. It was a total deliberate neglect of years of our health sector that got us here. It didn't happen overnight. So what for me is heartbreaking is that I campaigned for President Muhammadu Buhari, first time, second time. I believed that, the sort of consciousness, the kind of conscience I want for a leader, that he had it. I expected that things like, negotiating with Nigerian Association of Resident Doctors and making promises will be something that will bother him if he hears it again in the news. The first time, they have reached agreement with them. Second time, Minister for Labour is appealing. Third time, Minister for State of Health is appealing to the doctors. Please, what do they want? It's not rocket science to do a scale of preference and move these important issues under a pandemic to the most highest of priorities. And those small issues like wardrobe allowance, extra codes for travel can be converted to meet their needs. That's what I expect of a president that I campaigned for, someone I believed in.
Mariam, I know you grew up with a mom who was in the hospital permanently.
So I will tell you the story. So it's not just doctors who have these complaints. Nurses, I even think they have it worse. I mean, and all the other medical personnel. Because, in fact, in the hierarchy of things, doctors even tend to get some of their demands responded to quickly. Because somehow the minister is a doctor and things like that. But that is not to say that, they don't have legitimate concerns. Yeah, they do not have legitimate concerns. All of them, really, I feel that they have not been treated well. And, where you are saying that they are overworked and sometimes they will even shop when they're strike, that is very true. Because I remember with my mom, too, when they would go on strike, she would say, but that does not mean that we have to leave the place empty. We have some patients who are in critical condition that they need someone to be there. So even though we're not getting paid, even though we're not having our demands met, we understand how important this life is, and we have to be there for them. And you expect that when people give their all like that, they give everything. The government would appreciate. They have children at home. They are paying fees, they are paying rent, they have responsibilities. And then, when we talk about the person of the president, you would expect that for someone who has health issues, he will be much more in tune with the issues concerning health. He will be much more appreciative of having good quality health
accessible to everybody,
to him and everyone. So it doesn't make sense to me.
I am a medical doctor. I practice at the University of Calabar Teaching Hospital.
Okay.
So actually, when I was a medical student, I used to think that in many, many cases, students or the government had a point. But having been a doctor for a while, I see it from another view. It's practical insensitivity from the government. Who makes the government? Me, you. We make the government. And I see patients go through hell. They can't afford anything. Even if they can afford something, there is nothing in the hospitals. You can't even do anything to help patients. The hospital facilities are gone. Just minor investigations, full blood count, electrolyte urea creatinine, liver function test. You need to send patients out of the hospital facility to private investment.
Is the government owing you salary? Is the government owing you salary?
The government knows they are owing salary. It's a continuum.
Yeah.
This thing is not just when you look at the NARD strike and you just think it's about salary. That's not being fair.
That's true.
It's more than salaries. It's the resident doctor saying Give us something to work with and pay us. Paying us is, yes, important. A laborer is deserving of his wages.
Yep.
But apart from the salaries, are we going to, if the president travels abroad and he's going for investigations or going for tests and going for proper medical checkup, are they going to just look at him? They're not being paid there alone. There are things put on ground for doctors to work with. The health sector is really in a terrible mess. We should just stop thinking it's just salary. Apart from salaries, there are other congent issues that have not been addressed.
Yeah. So a lot of us are talking about the patients, right?
Yeah.
How the patients are affected, and that's the truth. Many people would, as they say, unavoidable death, a lot of money to be spent. You have to get a lot more money to spend towards treatment. But also the doctors. My mom, I remember when she worked as, how much was she earning? Very small amount of money. 3 children in school. Sometimes no salary, she had to wait on salary. And you know how women, so she's doing different sorts of, contributions with each other so that they can raise money to pay fees. So these doctors are paying fees, they are paying rent.
Yes.
These doctors will be at home now.
That is expensive and
a head teacher will send their child home because they have not paid fees.
Yeah.
And now they are home, or a landlord is calling and harassing a family now because they cannot pay fees. And the question will be, and you're a doctor, you're a doctor, you should be able to afford these things. Exactly. It's not right.
Oh, you're a first-time caller. Welcome to the show. So we want to know, were you trained in Nigeria? Are you one of those that went for greener, looking for greener pastures?
I've practiced in Nigeria before I moved to UK.
Okay.
And then, you see the problem with our health system? The problem with our health system is if the people ruling us cannot use our hospitals, then we don't have hospitals. Do you see people coming from UK to come for treatment in Nigeria? No.
What are they called?
But if your rulers cannot use your hospitals, they go outside. That means they don't care what you pass through, and they don't care whether your things are up to date or not. Imagine what the doctors are fighting for is what all the medical personnel are fighting for. Not only the salary, but when you are, like when I did my training in Lutz, those periods, there was everything in the hospital. Everything. As a patient, you don't need to buy anything. But now, if they want to give you common injection or
you have to go and buy the syringe.
You have to go and buy cotton wool, buy spirit. Okay, if you don't have money, what happens? So a lot of people will have died. So until our rulers are patronizing Nigerian hospitals, there will be no improvement. These people don't know what is going on. When they are sick, they go abroad. Their family is abroad. How come your family cannot live where you are ruling?